Making money as an optometrist, a young optometrist, or a young healthcare provider, whichever field you are in, is very essential, it's very important because we all, just like everybody else, need to survive. We need to have a source of income so we don't go out begging. Yes. So today I'm going to be teaching you on ways in which you can make money. You can generate funds, have a source of income, being an optometrist, a young optometrist likewise, or um, a young healthcare provider, however it is. Yes. I am Dr. Ufoma Juliet Onomwe, and this is my fourth year as an optometrist. I began as an optometrist in 2020, though I graduated in 2019. My induction was in 2020. Yes, so this is my fourth year practicing as an optometrist. Today, I'm going to be teaching you how to make money. If you just left school from a profession, you're done with your youth service, you need money, this is going to help you. Mind you, if you're an optometrist, you know already that you have to do your internship, you have to go for youth service. It is essential. According to our board, you must complete all of those things first before you are ripe enough to come into the employment market or whatever it is called, such that you'll be able to have money and all that. So you need to do your internship first, and doing your internship, you are going to be paid. Whether you are in a private sector or a public sector, you are going to be paid. Your employer is going to pay you. Yes, you're not encouraged to go to a place where you work for free because I mean you pay transportation and you eat and all that. So as an intern, you do your work, pay your dues. And after your internship, you're expected to go for your youth service, right? Go for your youth service and serve your country. The federal government is going to pay you. Your PPA might pay you. They should pay you as a doctor because you are a doctor and you deserve to be paid like that. But after all of these, after you've gone for your internship, you have gone for your service, what next? What do you need to do? How do you make money? Meanwhile, if you are seeing me for the first time, like I said, I am Dr. Ufoma Juliet Onomowe. Yes. I want you to follow us on Instagram, on YouTube, subscribe to our channel, on TikTok, do well to like, do well to share. It's the Ufoma on TikTok, it's Dr. Ufoma Juliet on Instagram. Yes, and on YouTube, this is me. All right, so subscribe, like, and share to your friends, to your young optometrists, to your young medical doctors, to your nurses, whatever profession they are in. Subscribe, share to them. Okay, now let's delve in. The first way to get money as a young professional is by getting a job. Get a job. Get a job. You need to get a job with a private sector, right? Most of the time, the government doesn't give jobs almost immediately. Government jobs could take time. If you are lucky, you are blessed, you could get a government job or government appointment. That's very great. You're going to really enjoy. But before you get that, you have to get a job with a private sector such that you have a stable source of income. You know that at the end of this month, so amount of money is getting into my account. You can plan yourself, you can budget yourself, budget your income, budget your spendings, and all of that. So getting a job is actually essential, is important. You could get a job in your city, you could also travel to another city to get a job. I'm saying this because some facilities, some hospitals provide accommodation. So if you are, for instance, you reside in, let me see, River State, right, and you want to go to somewhere like Abuja, look for a job that has accommodation because before you start getting accommodation and all that in those places, costs a lot of money. But staying in the hostel accommodation has its perks, it has its disadvantages. So you need to know for yourself that you'll be able to cope with that before relocating. If not, just stay in your state and work. Okay, that's the first one. Then the second source of income, yes, is by setting up your own practice. Yes, you can actually set up your own practice if you have the funds, if you have the money. So, according to Optometric and Dispensing Optician Registration Board of Nigeria, if you are less than 5 years of practice, you cannot set up your own clinic. Yes, you cannot set up your own clinic. But nonetheless, if you have the funds, your parents are equipped, they have money, or you have the source of income, the millions of naira or pounds or dollars to set up a practice, you can as well go ahead to set up this practice. But then you won't be the one running the clinic or seeing the patients, like doing all those things, right? You can actually set up, be the owner, the managing director of the place, but you'll be the one seeing patient, you will not be the one doing it. What you need to do is now to employ somebody with the required number of years, so the person does the clinic runs, managing the clinic, and other while you learn. But being a owner of the practice, you are the one. It's I mean it's your business, it's your practice. So you know what happens to the money, you know how to disburse your funds, and all of that. So it's not a total write off if you are less than 5 years. Just set up, let somebody else set the place up for you, an experienced person with the 5 years and above years of experience. Person sets up for you, runs the practice yourself, and then you learn till you are able to run your practice by yourself. So that is the second source of income, second way of making money as an optometrist, right? If you have not subscribed to my channel, please do well to do so, because we have a whole lot to teach you here. The third method or third approach towards making money as a young graduate, a young professional, health professional, and all that is to start a small business that is related to your field. For instance, as an optometrist, you can start a frame business. You can start selling optical frames. You can start selling frames. You can go to the market, or you can import frames from countries where they are produced. Do your marketing, your sales, and everything very properly, and then you are able to now sell, run your brand by yourself. You make sure you maximize your potential very well, such that that business can actually yield a lot of funds for you. So you can start a frame business, you can start selling consumables basically. So that is the third way making money as a young optometrist. Then if you are a nurse or a medical doctor, you can look for a small business, a small something really related to what you sell, a consumable or a disposable that you can actually start retailing. You sell to other people or hospitals, or you can sell online if your laws and your ethics permits you to do that. Yes. Then the fourth way to make money as a young professional is for you to start a channel basically online. Maximize your online presence. Yes, maximize your online presence by doing health talks, talking to, just freelancing, just giving back to your society, doing health talks and talking, right? Somebody can just notice you and say, oh, I love this person, I love this doctor, I love this nurse, I love this, I love how he or she carries him or herself, and the person could engage you by giving you contracts, giving you jobs, or if there's an outreach coming up, you could actually be in charge. So you need to maximize your online presence as a young professional. Then fourthly or fifthly is for you to start import sales of consumables or sales of instruments. So if you're an optometrist, right, you're an eye doctor, you can start selling, importing items, importing instruments, ophthalmoscope, retinoscopes, batteries, consumables. You can start importation business. You import and then you sell out. So selling out and selling, basically you need to go through the rules and regulations of sales, how to maximize, how to sell to people, how to get your target audience and all of that. But you need to put this in mind that you can start an import and export business. At a point in 2020, I needed an ophthalmoscope, and it was quite difficult to get one within my budget. And I have experience with import and export. I import things, I export hair, every other thing, yeah. So I had to look for a company who produces ophthalmoscope, and I imported my ophthalmoscope myself, and a few for my friends and my colleagues. And that was how I started my own small scale import business. So you have to do that. Then you could also import consumables if you're a nurse, if you're a doctor. You could actually bring them in and look for how to do your sales. Yes, I know we are together. I know you understand what I am saying. That is the fifth way. Then the sixth way of making money. Before I go into that, do well to like and share. I know you love what you're listening to, what you're saying. Like, share, subscribe to my channel. Okay. Yes. So you need to maximize your sphere of influence. Your sphere of influence, the places you go to all the time, the places you spend time in. These people need to know what you do, right? They need to know what to do. So if you are a medical doctor or you are a nurse, you always go to church, you always go to the mosque, or you have a community group or alumni association, they need to know that, oh, there's this person in our family, there's this friend I have that does this. Everybody around you needs to know that you're an eye doctor. They need to know you're an optometrist, an ophthalmologist, an optician, whatever it is you are. Your sphere of influence, they actually need to know that that is what you are, that's what you do, such that if these people have issues with their eyes, issues with their health, the first person they think about is what? You. They think about you. They think about you. Yes. So make sure your church, your pastor, your priest, pastor, your imam, is that how you call it? Yes. The head of your mosque, the head of your alumni association, whoever, they should know that this is what you do, this is who you are. That way, you can get contracts, you can get gigs, you can get sponsorships to do shelf free glasses to people, you can get gigs like that here and there, and that way you make your money, you make your input, you make your profit out of it. These people will not call you to come and do stuff without paying you an amount of money for consultation and all of that. So that way you're able to get small source of income. I hope you are following what I'm saying. Yes. So the second to the last way in which you make money as an optometrist, an optician, ophthalmologist, is for you to partner with NGOs, partner with non-governmental organization, or partner with the government. Yes, you can actually approach the ruling party of your state, or approach the local government chairman. Yes, and then let them know that, oh, I do this. I would love to render my services this way. I would love to do free screening for a particular local government, a particular school. And if they like the proposal you have given to them, they will invite you, and then they will provide the drugs to you. They will give you money. Okay, go and buy drugs. Go and buy consumables. Bring more doctors. Bring more people to actually do this outreach for you, basically, and then they would pay you for your service. So you need to think outside the box. You cannot just sit down in your clinic as an employee and you not think. You have to think outside the box if you really need to make money in medical profession. So when you partner with these NGOs, partner with the government, partner with a rich man, anybody, anyone, even those in your church that probably they want to do 60th or 80th birthday anniversary, you could also actually tell them that, oh, how about you incorporate this into it? That way you're already selling yourself out. As an eye doctor, you can say, oh, let's do free screening. Yes, this is my bill, this is my charge. This is what I'm going to charge you for your community. Since you're doing 100 birthday celebration or something, let's just do something for your community members. If you're a nurse, you can invite doctors or invite people. And at the end of the day, you are the contractor, you get your money. Yes, it's what we're giving back to society, but that doesn't mean we're not going to eat. So you make sure your bill, everything you are charging is relatively small, it's not so much, okay? Yes. Then last thing I'm going to tell you, first of all, saying that do also like my channel. I'm saying it again for the first or the fifth time. Do also like my channel, subscribe. Please subscribe, leave comments, okay? So the last is to partner with other health professionals. It's not just about partnering or talking to people who are not health professionals. Those who are health professionals who are related to your field need to know that they should be able to reach you. This is who you are, this is what you do, and you are good at your job, okay? So partnering is you referring to your colleagues, and your colleagues referring patients to you. So in my as an optometrist, basically, I do get a lot of referrals from medical doctors, from nurses, from physiotherapists, people who in my sphere of influence who know that I'm an optometrist, I'm an eye doctor, and I actually tell them, oh, as a medical doctor, or as this is what calls for when your patients come in. Like as a medical doctor, a patient comes and tells you they can't read, they're having headaches, something is wrong with their eyes, everything is blurry, they're not okay. Who you're thinking about is your optometrist, your primary eye care provider, right? That's who you're thinking about when the patient is complaining all of that. So just refer, refer to us, refer to me. Just refer. Yes, our medical doctors are really trying. I have amazing medical doctors in myself. You know, they're really amazing. Yes. So there are patients too who complain, who they give their complaints to nurses, or who give their complaints to physiotherapy. So now they just know that, oh, you are in the health field. They don't even want to know what specialty you are in. They just give you a complaint. So if you have eye patients who come to you and then they tell you this is what's wrong with me, you should think, you want to think about an optometrist, you're thinking about me. My point is that healthcare professionals in your field, in your sphere that you know about, should be able to trust you enough to refer their patients to you. That way, you're able to put a charge on your consultation or on whatever it is, and then you get your money from there. And outside that, if you run your practice, you could also partner with these professionals such that when they refer to you, and if the patient does a procedure or something, and then if you charge them, they are able to get a certain percentage of what, like a referral bonus, basically. So partner with ophthalmologists, a lot of them partner with medical doctors, talk to them, approach hospitals, be bold enough to stand up and go to hospitals and say, hello, I'm an optometrist. I just like to share my card with you, let you know what I do. If you have eye conditions, if you have issues with your eye and everything, if you have patients with this kind of complaints, do send them. So be creative. All these things I'm telling you now, I've done most of it. I can say 9 out of 10 of these things. I've done a lot of them. I've partnered. My church, they know what I do. I know, like, I'm not saying I'm a celebrity now, but as an optometrist in my sphere of influence, everybody knows what I do. I have a frame brand where I sell frames. Yes, I do that. My sphere of influence is maximized. I import consumables. I import instruments that I need or that my friends need at a charge. It's not for free, right? So I believe that you've learned. I don't want this video to be too long. So if you have questions or if you want to talk to me directly, my email is julietufuma.ju@gmail.com. Send me a message, send me an email, and I'm going to respond to you. If you want to know how to set up your practice, or if you want to know how to get a job or what to look out for, if you want to pick a job, do it to send me a message. Thank you so much for listening.